Good afternoon. I'm going to present today what we have done using technology to improve the life of patients affected by dystonia worldwide, to improve and create rehabilitation protocols for this condition that is now well understood in 2024. When we get into the protocol, design of the protocol, we follow 3 rules. The first rule is that the rehabilitation protocol created for the program needs to be complete, needs to be integrative, needs to be comprehensive. That means that if the person has a problem sleeping, general patients have problems sleeping, digesting, they have problems, alterations in perception, visual, auditory, emotional, they have movement problems, all this needs to be addressed. So every single symptom needs to be addressed in the program. It's not partial. The second rule is that tools needs to be dual. That means that the same tool that you use to test a neurological deficit, if repeated, will correct or treat this exact same deficit. And the third rule is that because we are aiming to change the wiring in the brain, we are reproducing the different stages through the rehabilitation process, the different stages of the human brain development in the womb. So we start with the skin stimulation, and we look for patterns in the skin that present altered perception, sensory distortion in the skin. And we found some areas in the skin that they don't perceive properly. Interesting that this correlates with the areas that they feel the symptoms. So if a person is affected by arm dystonia, they can tell you, this hand is not mine, it's yours. I don't feel it like mine. So, or if they have a leg dystonia, they may feel that it's numb or it's like an alien body. These are extreme cases, but the milder the case, they feel it, but not so intense. So it's interesting, changes in the perception in the skin. We corrected stimulating the skin and making proprioceptive exercises. We have created lots of different visual testing because there is a huge component in this dystonia. The spasms can be treated with vision exercises, eyeball exercises, and vision is affected. We created all these tools to check peripheral vision, eye tracking, pattern recognition, attention. We cover all the visual challenges from saccadic intrusions to saccadic motions, anti-saccadic motions. It's quite comprehensive. This one is interesting, the one that is like a rod chart test, but in video. So people are exposed to a patternless video, and they report what they see. In dystonia, people have a higher activation of the amygdala compared to general population, so they say, I see a ghost, or I feel fear. If you conduct big data frequency analysis on the feedback that we get on the platform, the word that comes as the one that is repeated the most is fear. So people affected by dystonia have a fear response that is exaggerated, so they live in a constant fear response. So we help with visual exercises that we pair with sound and music to calm down the nervous system. So we did exactly the same with sound. So we compose music and create sound exercises to actually measure exactly the same. We measure tracking, sound tracking, so the auditory spatial system, we track it. We also track the ability to discriminate frequencies, intensities, volume. And then one thing that we found, talking about the visual, is that people affected by dystonia have like a blind spot in the left corner of the left eye. This is very interesting, and this is one of the exercises that we use to spot it and treat it. So they need to count the purple hearts that appear on screen, and then they are finding it very difficult to count the ones that are in the corner that the brain doesn't perceive properly. So this is how you see this image. This is how they see. People affected by dystonia, in the bibliography you will see they even talk about phobia to light. But I don't think that it's a phobia. What we discover is that people have dilation of the pupils, so it's mydriasis, and it's actually anisocoria, because just the left pupil is dilated in the crisis. So we need to train the pupil to correct, and for that we were very creative and we thought about fireworks. So we create animations with fireworks that have a different time rate in order to train the pupil to constrict and dilate at different frequencies. This is exactly the same, but talking about the auditory system. On the A is how you hear it. B is how they hear it. As you can see, it's like this is a piece of music, and there's a change, so the music goes from soft to louder. So if we talk in musical terms, it goes from piano to forte. They hear it like triple piano to triple forte. So they feel it like too intense. The change is too intense. This correlates with paralysis in the stapedius muscle. This correlates with problems in the facial nerve that innervates the mid-ear, the stapedius muscle, plus the face. And that helps us to get into something very interesting. If this is happening, maybe there is a facial palsy. So we created exercises where the person needs to mimic a face, producing all the movement in the face that the human can produce. And we discovered that people affected by dystonia have a facial palsy, depending on the severity of the condition. This can be more or less intense. A facial palsy in the left side of the face that is particular to dystonia. It's not the same that people with Parkinson's present, it's particular to that. This is how you see these colors in the animation. This is how they see it in a crisis, because dystonia also fluctuates. In a crisis, the sensitivity of the retina changes. Like in other conditions, probably we are talking about changes in the dopamine levels that affects the sensitivity in the retina. This is an eye tracking exercise. On top, you see the real movement of the ball. On the bottom, you see the red ball shows the actual movement of the eyeball of the patient. You will see how the red ball accelerates to the right. And the green ball represents how the patient sees it. What is interesting, they have an nystagmus, a right beating acceleration, nystagmus to the right. The patient reports that the ball is moving backwards, and that's an illusion that is produced when you have a nystagmus to the right. So they help us in getting to this refinement. So they are presenting a nystagmus to right, a palsy in the left side of the face, a palsy in the left stapedius muscle. This indicating that probably dystonia is a condition of the right brain. There are many clues there. And then we get into the personalized, responsive, and evolving neurorehabilitation protocols. So we get into movement, because it was considered a movement disorder, so that's a big piece of the platform. People affected by dystonia have dysregulated expression of primitive reflexes. So you may encounter people who have a primitive reflex that is overactivated or underactivated. One example of overactivation would be that they have the swallowing reflex is too active and is preventing them from breathing properly. In a situation, the opposite could be in a blepharospasm and an eyelid dystonia, that the blinking reflex is underactivated. So they don't blink at the normal rate, they blink slower. So you can see all forms of primitive reflexes. So from inhibited walking reflex, so it is a way that could prevent you from walking. Another way that can prevent you from walking is to have an active plantar grasping reflex that makes your toes clench so you cannot walk. The program aims at modulating the reflex expression by activating the underperforming reflex and deactivating the ones that are expressed in a high degree. So when I started before the platform, I was treating people with exercises and movement to inhibit the reflex and modulate them. But what happened is that less than 10% of the patients were committed to practice every day the exercises for more than 3 months. Now we have more than 75% of people that go beyond 6 months. Why? Because we make it engaging. And we make it engaging putting the rehabilitation protocol inside choreographies, dance choreographies. So people like the rehabilitation. So they practice daily, and they do more than I ask them. So we have everything from Latin dance to Shaolin Kung Fu. We have drumming, juggling, Bollywood dance. We have disco dance, we have boxing, African dance, tango. So depending on what you want to work on, you choose the discipline. For example, in order to retrain a grasping reflex in the hand, juggling works really well. If you have a problem initiating the walking reflex, and you need to go one step at a time, that's very difficult when you are doing it in a rehabilitation setting. But with African dance, you can do it in a very engaging way, because it's a dance that is based on one step forward, one step back. So we can work on torsions of the spine. If the patient needs to walk slowly in order to retrain the basic motion and put together all the pieces of the normal walking, we use tango. Tango is wonderful for that because you can train slow motion there. So Bollywood dance is wonderful for cervical dystonia. We retrain and we switch off an overactive asymmetric tonic reflex using Bollywood. As you can see, we are using you can see in the image here in the left, in the middle, how we use it to alternate from one side to the other side, and in the center too. In the center, we are training different reflexes. And boxing is wonderful too. It works really, really well to move, to activate and deactivate the asymmetric tonic reflex. Drumming is wonderful and produces interesting responses in people affected with this stacked primitive reflexes, because it forces you to cross the midline and activate the hemispheres in a rhythmical fashion, right and left. One patient once told me that my therapy is basically right-left therapy, simplifying to the maximum, and it's true. We do rhythmical activation right and left, like walking, drumming, swimming, juggling, because this produces synchronization of the hemispheres. It's interesting because it looks like this sympathetic overdrive, and this problem in motion that dystonia is, comes always with a lack of coupling between the hemispheres, lack of proper connectivity, lack of proper dialogue between the hemispheres. So Shaolin Kung Fu on top with Latin dance. So we have lots of things for people to work on. We have conducted functional MRI studies, and you can see in the image before training how there was way more activity, lots of compensation, so the patient is not able to control the movement properly, and that produces like chaotic activation, and after training it optimizes. We have similar results on the cerebellum, reduction of activation, noise, we reduce noise in the brain, cortical and subcortical. This is an example of people worldwide that are following the system, and they are following at home. They feel that they are empowered to take care of the rehabilitation matters themselves. I'm happy that results are coming, and this opens new possibilities. This technology of interconnecting therapists and patients worldwide provide feedback and collaborate in the development of new protocols for millions of people that have been suffering forever. Thank you so much.